This model has been used in a lot of different places, and it's a little bit different than the traditional nursing process. You know, traditional nursing process has a long history, and actually we talk about 3 generations of the nursing process. The first one was assess, plan, intervene, and evaluate. Then nursing diagnosis came along in the 70s, and people put assess, diagnose, plan, intervene, and evaluate. API went to ADPI. And now, though, healthcare systems are really focused on outcomes or end results. And so we believe that this model, OPT, is a 3rd-generation nursing process because of its focus on outcomes. And if you looked at the ANA standards today, actually, there are about 12 steps to the nursing process because they, too, have inserted the influence of outcomes. So this model has been used in a lot of different nursing schools, and actually was involved in a little research study at Mount Sinai Hospital in New York, where the nurses on the units used this model, and some very interesting things happened. One of the things that happened is that the nurses did assessments on patients every 24 hours, but that's all they had was assessment data. And so they realized they were not really specifying outcomes, and they were not really being keyed into the nursing interventions. And so it really changed the way they engaged in practice in regards to using the model. There are also some advanced practice nurses that use this model, and they use this model at Northern Arizona University. They use it at the University of North Carolina in Wilmington. And the other thing they have done with this model is they're using the model and the structure of the model to debrief clinical simulations in terms of, oh, how did you get all of these things? What were you thinking? How were you organizing your thoughts in regards to that? And what was your judgment? And how did it move forward? And so it's a very good model, especially if you have complex patients with multiple competing demands and you don't know where really to start your interventions because there's so much there. If you take a little time and step back and begin to reflect and ask yourself these situations, you can really kind of figure out where the leverage points are. And in fact, it doesn't work just for clinical problems. I've had RN to BSN students, registered nurses who've been nurse managers, who've used this model in a very different way. They take a problem, an issue, and then they ask themselves, what are the consequences of that problem? And then they engage in the webbing and the reasoning, and they try and figure out what's the hidden dynamic in that system. And so they've used it in leadership and management as well.